கொஞ்ச நேரம் சும்மா இருமா போடும் போது. Don't disturb when sir is busy. Just now you told no. One flow is going on.
சரி மூடு கண்ணை மூடி के तरीके से लेके जाता हूँ कुछ थियोरेटिकल एस्पेक्ट में, उसके बाद मैंने प्रैक्टिकल लेता हूँ तो और मैं एलॉबरेटली शॉर्ट एंड स्वीट आपको मैंने एक नुस्खा यानी वन इन्फॉर्मेशन आई विल गिव यू ड्यूरिंग द प्रैक्टिकल, दैट टाइम यू डू द इम्प्लीमेंटेशन इन योर क्लिनिकल प्रैक्टिस एज वेल. नाउ
கொஞ்ச நேரம் சும்மா இருமா போடும் போது. Don't disturb when sir is busy. Just now you told no. One flow is going on.
சரி மூடு கண்ணை மூடி பெரிய மூச்சு வாங்கிக்கிட்டோம் முடிஞ்சது. This I use the lancet. This is actually lancet. பெரிய மூச்சு வாங்கிட்டோம்.
நானே கட்டலையே இவ்வளோ எல்லாரும் ரியாக்ட் பண்ணுறீங்க. சூப்பராக இருக்க பயமா இருக்கு. சார் ஆப்ஷன் தானே சார் பண்ணுவீங்க.
Please sir, please that video pin कर दीजिए. We are not able to see anything. Can you remove the slide?
No, you can see Jayashri or not.
Yes, the video is very clear. Arifa.
Sir, videos.
So play it now.
आपने उठा है बहुत में बैठा फिर मुझे पता दर्द सर बोलिएगा
இது எடுத்துட்டீங்கன்னா வெயிட் பண்ண முடியும்னு நினைக்கிறேன். நான் இருக்கேன்.
sir UG 3 you always say that
UP?
3 you can 25 also.
No, not like that. But on that particular area, we drain out the unwanted blood on the tree. Needle भी लगा सकते हैं. हाँ, सब good. Okay. Now I just apply UV one chan padu. मैं safe अपन रहे और पड़ा था. UB2, UB2 to UB1 connecting point, yeah. Then UB3, right? UB3 here, the markers right now.
Sir, you are not audible.
You didn't speak anything.
We can't say it. Sir, we can't see you.
Sir, we are not able to see anything or taste anything. Videos are
So अभी दिख रहा है क्या पोस्ट हुआ हमको? So you can see now.
Yes, sir.
I'm audible, by the way.
Yes, sir.
Oh, that's great. Now, just we applied some of the points. You have seen that UB1 is a vulnerable point, but UB2 directly we applied from the UB2 to UB1 connectivity. I have done the two procedures. One procedure to be known as a UB1 I applied, but if you don't want to do, you just apply from the UB2 to downwards direction. This is always is good to treat for the all the ophthalmic related disorders, especially for the frontal sinusitis, especially where the sphenoids UB3, UB4, UB5, UB6, UB7, UB8. There are the few points I just applied over this region for the day-to-day clinical practice. Only for the nose-related problem, which I told you, you just activate UB7 point. That really good point. But apart from that, is the important is the UB9 and then UB10 point. Now let me see. There are the 2 points. Try to recognize where this point is located. Now occipital protuberance. I try to see this region where exactly occipital occipital protuberance. You touch and feel. You touch and then feel. But this is as a occipital bone. Just below there is a depression. Below there is a depression. From here 1.3 chun lateral from the midpoint of the spine, lower border of the occipital protuberance. Now you can see 1.3 chun. Exactly this point below the bone there is a depression. In that depression I just apply this point. Towards the ear I just apply. Towards the ear I just apply. This is good point to treat for the vestibulocochlear nerve as well. Vestibulocochlear nerve related to the ear problem, and also there is a the posterior side of the visual cortex of the brain as well. This is the greater occipital nerve and also vestibulocochlear nerve, both to be activated by activating this point. But whenever there is the wind got affected into the brain, even that situation also we can use. By the way, this is good point to treat for the vision as well. Now UB10, which is the most imperative point, where exactly this point is located. Now I just try to see the posterior hairline. So this is the posterior. Now you can see the difference from here. This is the C7. From the C7 3 chun proximal. That means is that this is the posterior hairline. This line to be known as a posterior hairline. This line to be known as a posterior hairline. Right. From this posterior hairline, but however she have here, but occipital protuberance is here. Right. Occipital protuberance is here. From here 1.3 chun lateral in the depression I applied, but here is UB10 point is 1.3 chun lateral, then same just distal to this point downwards direction. This point to be known as a UB10 point, but UB10 point is the Tiansu. Now you can recognize this particular point is useful for the lesser occipital nerve as well. And by the way, this is on the C1, where exactly C1, C2, C3, C4, C5, C6, C7. So in that way, but this point is exactly midway between the C1 and then C2 atlas and axis region. I just apply this towards the multiple directions. So I just apply. If the patient is complaining about the cervical pain, I just apply in this direction. If the patient is complaining about the pain on the occipital region, you just apply perpendicular direction. When the patient is complaining about the ear problem, you just apply towards the ear as well. So in the 3 directions I just applied the same point, but however situation is there, accordingly you just do it. But when the patient is complaining, I do have the occipital headache and cervical pain, then you just use the perpendicular needle itself. So on the particular region you just apply the perpendicular direction. So directly you just apply. That's quite enough. But direction is very important. What condition, which direction you are going to apply. Maybe sometimes you are in dilemma, I don't know which direction I need to apply. In that situation, what you should do, you just apply the needle perpendicular. You need not to worry. Just apply the perpendicular direction.
How about the needles on the top of the
Yes, exactly like this.
These UB3 to UB7 always sedate on this.
Yes, you can do it in this direction, because my intention is treat for the nose. Then I just apply towards the nose, because this point is connecting to the olfactory bulb. Other direction perpendicular you just apply, or towards the back side also advisable. Yeah. So now hopefully we have seen that UB 10 point we completed. This is the one branch of the UB meridian got terminated now. ಬಟ್ ಒಳ್ಳೆ ಲ್ಯಾನ್ಸೆಟ್ಸು ಇಲ್ಲಿ ತಗೊಂಡು ಬಂದು ಇವಾಗಿಲ್ಲ, ಬಟ್ ನೀವು ಪ್ರಾಕ್ಟಿಕಲಲ್ಲಿ ಇರಬೇಕು, ಅದು ತಗೊಂಡು ಬನ್ನಿ. ಮೋಸ್ಟ್ಲಿ ಇಲ್ಲಿ ಮಡಗ್ಬಿಡಿ ಸ್ವಲ್ಪ ಲ್ಯಾನ್ಸೆಟ್ಸು. So now in the depression, point one tune about the inner canthus of the eye. मैंने बहुत हल्के तरीके से लेके जाता हूँ कुछ थियोरेटिकल एस्पेक्ट में, उसके बाद मैंने प्रैक्टिकल लेता हूँ, तो और मैं एलॉबरेटली शॉर्ट एंड स्वीट आपको मैंने एक नुस्खा यानी वन इन्फॉर्मेशन I will give you during the practical. That time you do the implementation in your clinical practice as well. Now point one shown proximal superior to the inner canthus of the eye. This point is located that to be known as a ching, ching, ming, ching, C-H-I-N-G, ching, ming. When you write J-I-N-G, ching, ming. But when you pronounce is the ching, ming, ching, ming. Right. Now the ching, ming point is located on the inner canthus of the eye. Inner canthus of the eye. So now when the point you need to insert, but this is a very vulnerable point because it is located inside the orbital cavity, inside the orbit के अंदर है. Then you just give the pressure to this region, or you just apply the needle. 0.5 chun deep needle or 0.5 to 1 chun deep needle can insert that particular region inside. But however, that can be applicable, but however I don't recommend to you all that you need to be applied to the deeper level that causes the problem. So therefore we try to refrain to apply. Normally what happens when there is the pustule comes over this region, some people have this region is some kind of the worms, kind of the wound formation in this region, then easily you can tell them you have the problem is urinary bladder, you have the problem, not the eye. You have the UB is indicating that yes, bladder problem is reflecting on the UB1. In that way we can recognize that. Number two is when the patient is having the problem is tears of the eyes is coming at the age of less than 1 year, or maybe sometimes you do have the tears, but the lacrimal glands are existing on this region where the U-yaw is extra 3 point. From there the lacrimal glands comes inside of the orbit region, then from here it comes out the tears. The tears comes here or the tears comes here? Inner canthus or the outer canthus? सर कब तो ये रोए था ना मालूम होता, ये लड़कियां तो रोते रहती हैं, छोड़ो, लड़के तो रोते नहीं ना, मगर ज़रूर रोना है. Men's also cry, नहीं? You make them to cry in that level. Right. शादी के बाद तो रोना चाहिए. Right. कौन शादी नहीं करे, they are really good. ठीक है. सो इनर कैंथस ऑफ द आई क्या होता है, जब टीयर्स एक्सेस होता है तो लैक्रिमल ग्लैंड सेक्रेट्स द मोर वाटर. So what kind of the water? One is the aqueous humor, the second one is the vitreous humor inside of the eye. So through that the secretion comes out and then it causes the problem. So hopefully we understand. Then that situation we cannot apply the needle. What we should do, give the pressure. आप प्रेशर यहाँ पे दे दो, फिर डेफिनेटली हाँ द पॉजिटिव इम्पैक्ट वो ऑप्थाल्मिक नर्व को एक्टिवेट करता है. सो देयरफॉर कौन से मसल्स पे वो हैं? या ऑर्बिकुलरिस एक्यूली मसल्स. इस मसल्स को हम क्या कहते हैं? ऑर्बिकुलरिस एक्यूली मसल्स. इस मसल्स को ऑर्बिकुलरी ओरिस मसल. वेरी गुड, ओरिस मसल, राइट. दैट इज कॉल्ड एज ए किसिंग मसल्स. So now this muscles exactly the point is located angular artery and also ophthalmic artery to be regulated by activating this UB1 point to treat for all the eye related disorders can be successfully treatable. मगर यहाँ पे जो inner canthus है, अगर inner canthus having the problem, then you can recognize there is the heart also having some impacted. No doubt I told you the pustule is there, urinary bladder problem. When the inner canthus of the eye, so inner canthus there is the curve, flip curved. So inner canthus that having the some kind of the inflammation, infection. Do you know iridology? Iridology is study of the iris, study of the overall eyes. So when eye diagnosis we wanted to know, so that time we recognize when the inner canthus having the problem, then we can consider there is a cardiac problem also they do have. So always they do the itching. So they rub and then itch to the inner canthus very rapidly. Then you remember there is some kind of the pectoralis or maybe the cardiac related problem or maybe the allergic related condition also reason. Once you continuously rub that, chances are there that will going to rupture your blood vessels. So that's the reason normally not at all advisable to rub In this way you can rub like this. Maybe you can do like this. You can do like this. Normally, once you wake up in the morning, then you wanted to you will going to see the brightness outside. So that time, actually, normally it's advisable to get up before sunrise to smoothen to the eyes. We will wake up at 8 o'clock, right? Right. So we rub this, that time we rub slightly like this. Then we open the eyes is good. When we rub continuously, that's not really good. That causes the major blood vessels will going to damage. Then the vision get impacted later period, and also excessive heat will going to increase in the eye system.
Because a not very good pathway, some internal pathway goes to the eye.
Eyes, yes. Which point will go to the connect to the eye? We completed. You are very correct. Very good. You are very correct. Tungli is the H5 point. H5 point is connecting to the eyes. So one more 2 points are there which is connecting to the, yes, exactly. So which is connecting to the eyes. That is also, perhaps I'll tell you, where the yang energy to activate it to the eyes, in energy is activated to the eyes. There are the 2 points are there to regulate that. Perhaps you can wait for the practical that I'll try to show you how that will going to connect to the eye system. That something is amazing. Now the second point to be known as a San Su. Second point to be known as a San Su, that is UB2 point. Right, UB2 point. This is where exactly the point is located. So just a medial end of the eyebrow. Medial end of the eyebrow, the point is located. Inside that region, there is a hollow, there is a cavity in that bone. The sphenoid bone, there is a small cavity. In that cavity, that point is located. That need to be bleeded. That need to be bleeded. So hopefully let me see how need to be bleed that point to treat for the vision related disorders, and which muscle that particular point is located. Yeah, corrugator muscle. Corrugator. This UB2 point is located on the corru, CORRUGATOR, corrugator muscles. This muscle to be known as a corrugator muscle. These muscles are orbicularis oli muscles, orbicularis oculi muscles, but these muscles are corrugator muscles. UB2 point is located. So there we need to bleed, but I'll try to show you how to be done that. So exactly what kind of this supraorbital artery. So supraorbital artery to be activated by using this one particular point, that to be known as a urinary UB2 point. So this very good point. When the alternate for that UB1 you cannot apply the needle, then what you should do, you just apply the needle to the downwards direction. You just apply the needle to the downwards direction, connecting to the inner canthus of the eye. So that to be known as a through to through needling. One needle connecting to the another point, that to be known as a UB1, UB2 by using single needle, right? Then further, we just try to connect from UB1, UB2. You connect this to the downwards direction.
We can use this point for instant headache.
Sorry?
Painkiller. We can use this one as painkiller also, right?
Yes. Now UB3 point is the Michung point. Yes? Which point is it? Yes, UB3 point is directly above the UB1, 0.5 chon within the anterior hairline between the DO24 to UB4. So exactly where this point is located, you come down upward direction. From the UB2 come upward direction above the hairline. But you just try to open and then find out where is the hairline. There you just apply UB2, UB3 point. Right, UB3 and then UB4, UB5 points. More are there, this is the supratrochlear artery. Trochlear, supratrochlear artery and supracochlear vein as well. So that means the connecting to the vision and also connecting to the ear also, directly indirectly is connecting to that region as well. Eyes and then nose, benefits to the eyes and nose and also sensory organs. Occipitofrontal muscles. So these muscles to be known as a mimetic muscles, frontalis muscles, the another name also occipitofrontal muscles, this name. But now let me see this the another point. Which point is it? UB4 point. UB4 point is located exactly 1.5 chon. 1.5 chon away from this line. 1.5 chun away from the midline and 0.5 chun above from the anterior hairline. The point to be known as a UB4. UB5 point again.
UB 3 points or UB 3 point, please.
UB 3 point is, this is as a UB2. Then you come up, this is the UB 3 point. This is the UB 3 point.
No, slide, sir, slide. I want slide.
Sir, DQ24 also there?
Yes, exactly. DO24
That's what
where?
I want to ask.
Yeah.
UB4 is the location of DU20.
This is DO24. You come from the nose bridge. Nose bridge you come directly. This is as a DU24, that is Shantang. This is Shanting, not Shantang, Shanting. But just 0.5 chun lateral. 0.5 chun lateral to the midline to be known as a UB4. UB3 is, yeah, 0.5 chun away is UB3. Again 1 chun lateral is UB4. 0.5 chun above from the UB4 is UB5. So these are the slightly 0.5 chun differs, but easily you can recognize this and then apply some of the points over this region. Normally we don't use these points, but some conditions we use to treat for the cerebrum, cerebellum, basal ganglia. Remember, cerebrum, cerebellum, basal ganglia. Do you know the Yamamoto new scalp acupuncture? But in that way, but here 3 points are located in this region. I'll try to show you when I apply the needles on the UB3 practically. But there, yeah, 3 points I used to apply to connect to the brain. One is the cerebrum, cerebellum and basal ganglia. 3 points are 3 lines and 3 points are located in this region to treat for the all the brain and then spinal cord related disorders, especially for the brain conditions. So hopefully we understand this. Right, further we're going to see the UB6 point. Yeah, UB5 point is not that great indications over this region, but headache, dizziness, hemiplegia, epilepsy you can treat. But now if the problem is on the right side, you just try to apply on the opposite side. Whenever there is a problem on the right, the UB7 point. UB7 point, where exactly located the location? 4 chun proximal to the anterior hairline and then 1.5 chun lateral to the midline. That to be known as a UB7 point. Bilaterally you just apply where the olfactory bulb giving the command to the nasal septum. Right, number 1 is the nose related problem. Anosmia especially, that's good for the loss of smell after the COVID situation. Still the people are suffering in that situation. You just activate the point to be known as a Tung Tian, downwards direction. Bilaterally activation is really good. Number 2 point is to be known as a In Tang point. That is the extra 1 point midway between the 2 eyebrows, where normally bindi is placed on the glabella region. Number 3 point to be known as a Bitung. Bitung is the extra point which is located on the medial side of the border of the Alanasi. On the nose this point is located. You just apply the Bitung, B-I-T-O-N-G point, Bitung point for the nose. Remember, I have successfully treated the people who are suffering for the nasal blockages or the rhinitis or running nose, maybe any kind of the stagnation or the blockages in the nose system. No doubt it's a totally blockage. Yeah, polyps obviously, but up to 50, 60, 70% of the blockages of the polyps. So inside the nasal septum they do have. Even that situation also successfully can treatable without any surgery, can be easily treatable by activating this point. So now further, along with that, I recommend you, there is another point to be known as a Ying Xiang, Y-I-N-G-X-I-A-N-G, Ying Xiang, that is welcome the fragrance. Right? So those points are lateral part of the Alanasi. The points are located bilaterally. You just activate through to through needling. You just apply this needle apply in this direction. That's really always is good. Then the next level of the points, overall you have used as a local points. Now you wanted to use as a distal points. You know, the nose is connected to the pulmonary system, lungs and also large intestine. Therefore only the 2 points you just activate. One is the source point, the other one is the nexary point. You just add up that to be known as a LU7 is the luvo connecting point, and further LU7 is connecting to the from the lungs to the large intestine. Li4 is the source point, but by the way Li4 is the topmost distal point for the facial region. By the way, it is the distal point for the sensory organ as well. Now you are treating to the nose. Nose is the sensory organ, so therefore that can be successfully treatable for the nose related disorders. Now you applied the LU7 and then Li4. One is the balancing midway between the each other exterior and interior relationship to be taken place by activating the LU7 and LI4 as well. But whoever they do have the nose related issues, I recommend them because the pulmonary system is partially affected, but refrain to going the pollen, pollution, smoke, dust shouldn't enter into the nasal septum and throat system. That need to be refrained. Further, the people who consume the lot of dairy products, milk products, especially the tea, coffee, chai, something like that is a greater level. I think that need to be refrained. Chances are they that we're going to develop the phlegm accumulation or the retention in the pulmonary system, and no doubt the spleen is producing the phlegm and the lungs are the container of the phlegm. So once it is stored in the container of the phlegm, so that slowly execute on the throat and then nose related condition. If the nose get impacted, then you remember easily that will get impacted on the Eustachian tube, which is connecting to the ear system as well. So therefore the nasal blockages then affect to the ear blockages as well. Due to that reason, you wanted to release and open the nose and then ear related problem, you can do one kind of the exercise that to be known as a hold the both the nose and then tightly close your mouth and then blow inside the balloon inside of your mouth. Then you can find that opening of the Eustachian tube. So therefore ear blockages and then nose related problem, both easily we can do some kind of the exercises. One or other way will be helpful to treat for the both the conditions. How? You just close it your nose tightly, you just close with the nose and then close your mouth as well. Blow internally, you just blow it. It open the ears. Right? In this way, you keep doing the same. One or other way will be helpful. By the way, along with that, advisable to do the steam inhalation and also cleaning with the Nadi Shuddhi. Pranayama also advisable. And Jalaneti, if you are comfortable to do that, you just use the Jalaneti, put it the water in the one nostril, the other nostril water get flows. So in that way, you keep doing the same. That will be overall the cleansing to be taken place. But obviously, having the maximum recovery. If the lungs, if the nose are good, then the oxygen passing to the pulmonary system, lungs also good. There is a lot of vibrissae Almighty kept inside the nasal septum. So there is that hairs also having the defensive mechanism where exactly the foreign substances, the particles or the unwanted dust, pollen, pollution, smoke is entering through the nose system that will going to destroy, that will not pass inside the pharynx and then larynx through the nasal system and through the mouth system where the white blood corpuscles, where the exactly there is the WBCs are engulfing all the bacteria which is unwanted virus which is entering through this nasal septum. So UB 8 point is the Lao Shu. Lao Shu is the point where exactly located is 5.5 chun. Do you know where is the Pai Hui? Where is DU 20 point is located? Center of the brain, right? But center of the brain you assume that. But of course in midway between the two hemisphere that point is located. But 0.5 chun superior and then 1.5 chun lateral to the DU20, the point to be known as a Lao Shu. Lao Sha means in the Chinese there is a teacher and a Lao Shu, this point is UB 8 point, but this point is signifies that exactly there is a pineal gland point. This point to be known as a pineal gland point. So pineal gland is the very, very important point. Alright. Pineal gland is important point for the sleep, isn't it? So what exactly function of the pineal gland? It induces the natural sleep, right? So what kind of the hormone will going to release with the pineal gland?
Melatonin. Melatonin, sir.
Yes, melatonin will going to release at the time of the night, right? Especially when the daytime you are sleepy, then it's not really good. But nighttime you are not taken the enough sleep also could be the reason. But the daytime you are taking the nap, that means the daytime it's releasing, nighttime is not releasing. But however, in the nighttime need to be released the melatonin, which is very much essential to induce the natural sleep is required. So by what time we're going to release? After the sunset, started getting this slowly we're going to release the melatonin. But after around 7 hours, normally says is the surface sleep, then it is the deep sleep. So when will be the deep sleep will going to happen? Kab chora atin sa gharan ko? What time the thief will enter at home?
Midnight 12 से 3 बजे तक, sir.
Yes, midway between that time to be known as a peak time for the sleep. That means is the after the sunset, 7 hours later, That to be known as a pineal gland will release the high level of the melatonin. That to be known as a 0.1 gram, or maybe it is related to maximum 1 mg, not gram, 1 mg, 1 milligram. 1 milligram, I think you people know Restil and then Alprax, 0.25 mg, 0.5 mg, 1 mg, right? All those things are maximum dosage. But that Restil going to release the melatonin artificial level, Zolpidem will release in the artificial level, right? Clonazepam, right, will release in the artificial level, but whereas in here naturally will going to release the dopamine by activating the pineal gland is good, then certainly that will going to release the amount what required for the natural sleep. Every day, every night, the duty to release every day, right? So therefore we recognize the dopamine is very much, the serotonin, and also serotonin released by the gut and indirectly helping to the brain as well to release the melatonin as well. So therefore melatonin is very much essential to inducing the natural sleep by activating the UB8 point. But I recommend you, in order to get the maximum recovery of the sleep, then you just add up the 2 points always is good. But 1 point to be known as a Pai, Hui, the another name to be known as a Sahasrara chakra, or the heavenly chakra, or the crown chakra, or the cosmic chakra, or the heavenly chakra, or the universal chakra, which is located on the top of the vertex of the head, where exactly on the central point. But this part, the pineal gland also located on the central part of the brain, where exactly on the epithalamus, thalamus, hypothalamus, epithalamus, subthalamus. But the thalamus is epithalamus, where the pineal gland is located. In that location, definitely you can activate the DU20 and then UB8 points bilaterally you just apply. Then further there is the Shenmai. There are the H7 and then UB62. These are the 2 points. Along with that, you just activate repeatedly if the people will continue the treatment for the span of 10 to 20 days. But later that will going to slowly convert in the form of the natural sleep. Don't ask me that the people who take the alcohol and other some kind of the narcotics and sedatives and also some kind of the other hypnotics and sedative medicines, they too get the natural sleep. But however, normally natural is different from the synthetic. Synthetic is different from the artificial and then natural. So therefore, whatever they take the alcohol and then they sleep, they feel that, oh, morning is okay. But still they do have the problems. Still, they do have the problem. They made the habit. I do the lot of work, stone work, and also breaking the stone work, and also lot of vigorous metal work, something like that. And they says that my whole body is aches, and due to that reason I take 190. Then I'll become the normal in the morning, like a 180. So today is 80, tomorrow 180. Then again is slowly stepping into 360, and so on. You will going to on the occasions, because of the marriage, because of the celebration, because of the festivals. On that day, how much? Maybe he will take greater than 360 plus 360. You multiply that, add up that, you will come to know that level they take. But most of the people on the road, why is it so? That will not give the natural sleep. Remember, all are unnatural. So therefore, hopefully you understand.
All 4 points at once.
Yes, you can activate all these points. UB8 and then DO20, H7 and then UB62 points you can activate.
Depression, insomnia,
Yes, insomnia, depression, anxiety, neurosis, all can. Now UB9 point on the posterior aspect, where exactly this point is located. So now 1.5, 1.5, 1.5, 3 points in the 1.5 destination. What are those? UB6, UB7, UB8. Remember that much. Other points are 0.5 chun variations, right? 0.5 chun variations, UB3, 4, 5. So these are the 0.5 chun variations of the points. One is 0.5, it's there in your mind. The other is 1.5 point, 3 points is there. Now UB9 is the U-Zen, where this point is located, UB9 point. Shukran, sir. .3 chun lateral, 1.3 chun lateral, 2.5 chun superior to the posterior hairline, to be known as a UB9, that is the U-Zen point. The importance of this point is treating for the vestibulocochlear nerve. This is something I love this. Vestibulocochlear cochlear nerve. What is this vestibulocochlear nerve? Which is connecting to the auditory meatus or auditory cortex of the brain on the temporal region. Vestibulo is the vestibular inner ear. Cochlear is the where exactly, that also inner ear, part of the ear. So inner ear, vestibulocochlear nerve impacting on the brain to get the hearing. To get the hearing. So therefore hearing need to be activated mild to moderate level if the patient having the problem. In that situation definitely we can add up the point that UB9 point is always is good to strengthen the auditory function. No doubt this point also treating for the greater occipital nerve as well. Greater occipital nerve, because that point is located on the visual cortex of the brain, posterior visual cortex of the brain. This region to be known as a vision area. We can activate for this condition over this region. So hopefully you understand this UB9 point. Now is my amazing and wonderful point. I love this point too much. But number 10 point to be known as a UB10 point. UB10 point, we will get some confusion where this point is located. UB10 and Galba, I'll try to clear now. This is my lovable points. मैं प्यार करता हूँ इसको.
ये बात प्यार करेंगे.
सर आप ऐसे बोल रहे हो
नहीं, मेरा हर एक दिन इसको मैं लगाना है. हर एक दिन पता नहीं मैं चुबाता हूँ. अभी कल एक औरत आई थी तो फिर उसको मैंने, वो आर्थराइटिस था उसको, कल रात में क्या नाम था उसका, कुछ नाम था ना लेडी का, तो फिर उन्होंने बोला एक पॉइंट लगाया तो फिर ठीक है बर्दाश्त कर ली. फिर मारते हो, कहाँ पे मारते हो अभी? उन्होंने पूछा कहाँ पे लगाते हो, तो और ये कहाँ मारते हो नीडल. ठीक है, तो ऐसा मैंने पता नहीं कितने लोगों को हर एक दिन लगाता हूँ, इसीलिए मैं प्यार करता हूँ. इसका मतलब है कि एक खुशी मिलती है ये ट्रीटमेंट करने में. तो फिर उसको वो जो जितना नेक टेंशन रहता है वो टेंशन दूर होता है. टेंशन इज़ द प्रॉब्लम, राइट. वो टेंशन को दूर करना ही मुझे उसको लगा के दूर करना है. सो एवरी डे आई यूज टू अप्लाई. मगर ये इतना सुंदर पॉइंट है, इतना सुंदर पॉइंट है. आप याद रखिए, अगर मैं इसके बारे में बोलूँ 10 मिनट या 20 मिनट भी बोलते रहूँगा तो बोलते ही रहूँगा. इतना अच्छा सुंदर पॉइंट है. तो अभी हम देखते हैं लोकेशन, मगर जब प्रैक्टिकल होता है तो तब थोड़ा बहुत ज़्यादा बोलने की कोशिश करता हूँ. अभी जस्ट मैंने ग्लांस देते रहता हूँ क्योंकि 67 पॉइंट्स हैं. पता नहीं अभी 10 मैच बैठा हूँ मैं, 2-12 हो गए नहीं. अभी पता नहीं कब ख़त्म करूँगा. तो ठीक है, तो UB10 पॉइंट जितना भी हो सकता है करेंगे. तो UB10 पॉइंट एक 1.3 चून लैटरल, कहाँ पे एग्जैक्टली आप एक फोकस कर लो कहाँ पे है. और जब मैं बोलता हूँ तो किसी को सामने बिठा लो या फिर और आप ख़ुद भी नोटिस कीजिए वेयर एग्जैक्टली. यहाँ पे एक पोस्टीरियर हेयर लाइन है. हेयर लाइन इज़ डिफरेंट फ्रॉम द हेयर्स. अगर कोई घुंघरू बाल छोड़ के नीचे तक कोई छोड़ रहा है तो फिर वो छोड़ रहा है नीचे का मतलब वो नहीं कि वो पोस्टीरियर हेयर लाइन नहीं है. जिस जगह से हेयर शुरू होता है, ठीक है ना. सो वेयर एग्जैक्टली स्टार्ट एंडिंग पॉइंट ऑफ द हेयर लाइन, वेयर इट एंड्स द हेयर लाइन, दैट टू बी नोन एज ए पोस्टीरियर हेयर लाइन, इजंट इट. नाउ इन द पोस्टीरियर हेयर लाइन 0.5 चून अबव द पोस्टीरियर हेयर लाइन, 0.5 चून ये हेयर लाइन है. 0.5 चून अबव द पोस्टीरियर, पोस्टीरियर का तो बैक हेयर लाइन. उसके बाद 1.3 चून लैटरल टू द मिड लाइन. 1.5 चून ये मिड लाइन, ये पूरा मिड लाइन है. ये मिड लाइन 1.3 चून, इसका मतलब है आपने 2 फिंगर्स रख लीजिए, 2 फिंगर्स 1.3 चून लैटरल टू द मिड लाइन. तो आप एग्जैक्टली वो जो फिंगर हैं, जिस जगह पे फिंगर बैठ रही है वहाँ पे 1.3 चून लैटरल अप्रॉक्सीमेटली कीजिए. इतना आप स्ट्रेस मत लीजिए. हो 1.3 1 चून ओके. 0.3 कैसा फाइंड आउट करेंगे? 0.3 मतलब इसमें आता. 0.3 का मतलब ये हाफ इंच, ये हाफ इंच, राइट. हाँ, इसमें आधा 0.3 चून. तो थोड़ा बहुत अप्रॉक्सीमेटली मतलब ऐसा आप रख लीजिए. ये 1 थंब इज़ द 1 चून और थोड़ा सा साइड में इतना बाहर ले लीजिए, वहाँ पे आप लगा दीजिए. दैट टू बी नोन एज ए UB10 पॉइंट इज़ 1.3 चून लैटरल टू द पोस्टीरियर हेयर मिड लाइन एंड देन 0.5 चून अबव द पोस्टीरियर हेयर लाइन. सो यहाँ पे ये पॉइंट हो गया. तो उस पॉइंट वो एग्जैक्टली कहाँ पे हैं? अगर हम लोग एनाटॉमिकल लेवल में अगर देखते हैं, देन यू रिमेंबर वेयर द ब्रेन स्टेम इज कनेक्टिंग टू द स्पाइनल कॉर्ड. ब्रेन स्टेम इज कनेक्टिंग टू द स्पाइनल कॉर्ड। कहाँ पे C1 C2 C3 शुरू हो रहा है? मेडुल्ला ऑब्लोंगेटा इज द लोअर पार्ट ऑफ द ब्रेन। मेडुल्ला ऑब्लोंगेटा कनेक्ट होता है C1 C2 C3 वर्टेब्रास को, और C1 C2 के दरमियान में क्या है? cerebro spinal fluid is there, but fluid is located in the brain, but that same fluid is connecting and reaching to the cauda equina of the lower portion of the back। तो फिर डायरेक्टली एक इलेक्ट्रिसिटी पास होता है, डायरेक्टली एक फ्लूइड पास होता है, डायरेक्टली एक एसेंस पास होता है, डायरेक्टली एक मैरो दैट्स कॉल्ड एज ए सी ऑफ द मैरो एंटरिंग थ्रू दैट स्पाइनल कैनल, वर्टेब्रल कैनल। तो फिर उस दैट पर्टिकुलर जंक्शन टू बी नोन एज ए UB10 point, UB10 you just apply towards the spinal cord, towards the medial side of the brain। अगर आप एक्टिवेट करते हैं then you remember you are connecting to the brain and then spinal cord। C1 कहाँ पे C1 शुरू हो रहा है? 0.5 shown about to the posterior hairline only C1 C2 C3 starts। हर एक मरीज को जितना भी प्रॉब्लम हेड रिलेटेड प्रॉब्लम है C1 C2 C3 मोस्ट ऑफ द ब्रेन रिलेटेड प्रॉब्लम, मोस्ट ऑफ द स्पाइन रिलेटेड प्रॉब्लम आप ज़रूर वो बिंदु को लगा सकते हैं, क्योंकि UB10 जब मैंने आपको और भी बहुत सारा सीक्रेट है, जब मैं वो चीज़ बताऊंगा पर्टिकुलर वो टॉपिक पे, देन यू विल गोइंग टू लव टू द सब्जेक्ट। Yeah, not same line, it is actually one tune again anterior to that region, मगर वो closer to that region। अगर one tune needle you are applying, अगर आपने स्पाइन को towards स्पाइन लगा दिया, मगर C1 का related condition भी treatment हो जाएगा। So that's what is the beauty of this particular point। UB10 point is the great point to treat for the cervical vertebrae and also to treat for the this junction of the skull, that is the BC junction, brain and then cervical junction, medulla oblongata and then is the C junction, that is the cervical junction। उसके लिए हम ट्रीटमेंट करेंगे। तो जितना भी आपका ब्रेन रिलेटेड एक्सिपिटल हेडेक, देन इट इज़ द विजन रिलेटेड प्रॉब्लम, ये सब चीज़ों के लिए एक महत्वपूर्ण पॉइंट होता है, दैट टू बी नोन एज ए UB10 पॉइंट। डे टू डे क्लिनिकल प्रैक्टिस जितने लोगों के लिए अपर ट्रेपेजियस मसल्स, जिस जगह ट्रैप्स यानी SCM मसल्स, ट्रेपेजियस मसल्स शुरू होता है, उस जगह से आप ट्रीटमेंट कीजिए। डेफिनेटली 2 मसल्स आल्सो गोइंग टू रिलीज, द occipital nerve will going to release, along with that the occipital cervical pain also patient feel lot of changes on the top of the vertex of the head। ये top of the vertex to be taken place by which vertebra? C1 vertebra। This glabella to be taken care by which vertebra? C2 vertebra। Eyes to be taken care by which vertebra? C3 vertebra। Mouth to be taken place which vertebra? C4 vertebra। Throat to be taken place by which vertebra? C4 and then C5 vertebra। So likewise, so this is incorporated in this region। अभी आप लव करते, प्यार करते, नहीं करते? बोलो ना, आप करते नहीं करते? मैं तो करता हूँ। तो आपको अच्छा लगता है ना? प्रॉब्लम इज समवेयर, बट यू आर फोकसिंग ऑन टारगेटिंग एज पर द मॉडर्न मेडिसिन। अपने टारगेट कर रहे हो, लेकिन ये आपको कोई भी किताबों में इतना आसानी से पता नहीं चलेगा। यू जस्ट टेक इट ऑल द TCM बुक्स, कहाँ पे आपको मिलता है दिखा दीजिए मुझे। लेकिन एक एक्सप्लोरिंग, रिसर्च, एनालाइजिंग, एक्सपीरियंस, प्रैक्टिसिंग, ये सब चीज़ मैंने आपको दे रहा हूँ।